You know that moment when your cat starts doing something, maybe just a little bit too much, like licking the same spot over and over, or maybe obsessively chewing on your sweater?
Yeah, those kinds of things.
Well, today we're diving deep into those, head-scratching repetitive behaviors in cats.
Yeah.
Trying to unlock some of the mystery.
Exactly. We're drawing from a really solid veterinary text today, and the plan is basically to pull out the key insights for now.
Right.
We want to make sense of these behaviors. What are they? Why might they be happening? And importantly, what can be done? But, keep it clear and straightforward.
Definitely. Because sometimes it's clearly more than just a funny little quirk, isn't it?
It can be.
Our source talks about what it calls compulsive disorders. And this isn't just like your cat loves chasing a feather wand.
No. It's when normal cat behaviors, grooming, chewing, that sort of thing, get really exaggerated. They happen out of context, and they don't seem to have a point anymore.
And they can actually cause problems.
Yeah, sometimes they interfere with the cat's life, like grooming so much they lose fur or get skin sores.
Okay.
The text actually starts broader, using the term abnormal repetitive behaviors, because honestly, before a vet figures it out, it could be several things.
That makes sense.
So that's our focus today. We'll dig into three main ones mentioned. Psychogenic dermatitis, or alopecia, that's the overgrooming causing hair loss.
Right.
Compulsive fabric chewing, and also feline hyperesthesia syndrome, which can look pretty dramatic sometimes.
Okay, so let's start there. What really defines these behaviors? How do you know it's crossed the line from normal cat stuff to this?
Well, the key things the text points out are that the behavior is usually pretty rigid, like the cat does it the same way every time. It's an exaggerated version of something normal, but it happens at weird times or way too often. And it doesn't seem to achieve anything useful, like endlessly grooming a perfectly clean patch of fur.
So it's the intensity, the repetition, and the pointlessness, kind of.
Yeah.
More than just a thorough groomer.
Exactly. And the text stresses it can get so intense that the cat might stop doing other important things, playing, eating, interacting.
Wow.
Or, like we said, it might even harm them, like the skin damage from licking. And it's probably not just one thing causing it. The text suggests it's likely a mix, maybe compulsive elements, maybe stereotypic, fixed patterns, maybe even some neurological stuff involved.
Gosh, it sounds really complicated then. So if you're seeing something like this, where do you even start looking for the cause? What kicks it off?
Okay, number one, and the text is really clear on this, rule out medical problems first. Always.
Right. Vet check.
Absolutely. Skin allergies, parasites, pain, even subtle seizures, those have to be checked by a vet. Only after that can you really start digging into the behavioral side.
Okay.
And the text suggests potential behavioral triggers could be things like maybe the cat feels confined or there was a specific stressful event.
Like house move or
Yeah.
a new pet.
Yeah, exactly. Or sometimes it's more ongoing stuff, conflict with another cat, general anxiety, maybe just frustration if their needs aren't being met.
So those initial stresses can start the ball
I
rolling.
think they can. And what's really fascinating, the text notes that over time, the behavior can kind of detach from that original trigger.
Yeah.
It becomes fixed and independent is the phrase used.
Huh. Like it takes on a life of its own.
Sort of, yeah. It's almost like the habit itself becomes ingrained, regardless of whether the initial stressor is still there.
Okay.
And there's also this idea of self-reinforcement. The repetitive action itself might, in a way, help the cat cope. It could be soothing or maybe a way to burn off anxious energy.
Interesting. Almost like a coping mechanism that's got a bit haywire.
That's a good way to put it.
Okay, let's dive into the specifics then. Psychogenic dermatitis and alopecia, the overgrooming one. What would you actually see?
Typically, you'd notice your cat grooming one area really intensely, often licking, maybe chewing or pulling at the fur, to the point where you see hair loss, that's the alopecia, and the skin underneath might get red or irritated, the dermatitis. The text says the grooming can become so consuming it pushes out other activities. Common spots are the groin area, the belly, and the inside or back of the thighs. So you might see thinning fur or even bald patches there.
So definitely not just seasonal shedding. You're seeing skin.
Exactly. And that skin, like I said, might look okay sometimes, but often it can get inflamed, maybe even develop sores from all the licking.
Gosh.
And looking back, the text mentions owners might recall it starting around a time of environmental change, or maybe after a bad flea problem, or even a diet switch. Those can sometimes be clues.
And how does the vet figure out it's this and not, say, an allergy?
Well, ruling out the medical stuff is key, but one specific test mentioned is a trichogram.
Okay, what's that?
They look at plucked hairs under a microscope. With psychogenic alopecia, you often see the hair shafts are cleanly broken off at different lengths.
Ah, from the licking and chewing.
Exactly, trauma from the tongue. If it's behavioral, other skin tests like scrapings for mites or allergy tests should come back negative. It helps narrow it down.
Right. Process of elimination.
Yeah.
Okay, what about the compulsive fabric chewing? That sounds odd. Is it common? Any particular cats?
It is quite specific, and interestingly, the text points out it seems more common in Siamese, Burmese, and other related Asian breeds.
Oh, really?
Yeah, which does make you wonder about a possible genetic component, though more research is needed. Age-wise, it usually starts when the cat's an adult, typically between 1 and maybe 4 years old, often around 2. So not usually a tiny kitten thing.
So it's not just exploring with their mouth like kittens do.
Right. These compulsive issues generally aren't seen in very young kittens. With the fabric chewing, owners might notice the cat prefers certain materials. Wool is often mentioned, or maybe a specific texture, and they tend to use their back teeth, the molars, to sort of grind on it. And the big danger there, obviously, is swallowing pieces.
Yeah, that could cause a blockage, couldn't it?
Absolutely. A gastrointestinal obstruction is a serious risk. That's why the text strongly advises creating a fabric-free save zone for these cats, especially if they're left alone.
Makes sense.
Management is crucial. And interestingly, there's also a dietary suggestion mentioned, increasing fiber content in their food.
Fiber? Why's that?
The thinking isn't totally clear, but it might help them feel fuller or perhaps address some subtle nutritional aspect. It's an interesting angle mentioned in the text.
Huh. Okay. And the last one. Hyperesthesia syndrome.
Yeah.
Sounds intense. What happens there?
Yeah, this one can be really quite distressing to see. Onset is usually between 1 and 5 years old. A key feature is that episodes often seem triggered by touch, especially petting along the back or near the tail.
Wow, so just normal petting can set it off. What does an episode look like?
It can vary, but signs often include things like dilated pupils, maybe drooling. The cat might cry out like really alarming yowls.
Oh, dear.
A really characteristic sign is often called rippling skin. You literally see the skin twitching or rolling along their back. That's the cutaneous truncey muscle going into overdrive.
Right.
They might suddenly urinate or defecate inappropriately. Tail twitching is common. Frantic grooming, sometimes biting or scratching themselves or even lashing out aggressively towards the owner or another pet.
Yeah.
And sometimes they just bolt, like they're trying to escape their own skin. It's really bizarre and upsetting.
Sounds awful. For the cat and the owner, is there anything that helps?
The text notes there are anecdotal reports. So, based on vet experience rather than large studies cited here, that the medication gabapentin, which is used for seizures and nerve pain, can sometimes help reduce how often these episodes happen and how severe they are.
Okay, something to discuss with the vet then.
Definitely.
So, pulling back a bit, if you, the listener, are noticing any of these kinds of repetitive, maybe excessive behaviors, what are the big takeaways from the text on how to approach it?
Well, a really crucial point is try not to reinforce the behavior with attention. It's hard, but even scolding them or trying to physically stop them can sometimes backfire.
Oh, so?
It can increase their anxiety, which might actually make the behavior worse in the long run. The advice is usually to ignore the behavior itself, if possible, and try to redirect the cat towards something positive, like playtime or maybe a food puzzle.
Ah, distraction with something good.
Exactly. And of course, trying to identify and remove any triggers in their environment is huge. If you know petting their back sets off the hyperesthesia, you avoid that specific trigger, for example.
Right.
And generally, creating a really predictable, low-stress environment is key. Consistent routines for feeding, play, interaction, minimizing big, sudden changes. Stability helps a lot.
Routine and calm. Got it. Now, if you suspect one of these issues, what's the diagnostic path usually look like?
Like we said, step 1 is always the vet visit to rule out medical causes. That means a full physical exam, probably blood tests, maybe urine tests.
Standard stuff.
Yep. And if hyperesthesia is suspected, especially with those neurological-like signs, the vet might discuss advanced imaging, like a CT or MRI, though that's less common. Then there are the specific tests we mentioned, the trichogram or skin tests for alopecia, maybe checking lead levels if pica or fabric chewing is happening, depending on the situation.
And once you have a diagnosis, what's the treatment plan typically involve?
If medication is part of the plan, the text suggests the goal is often to get good control for about 2 months.
Okay.
Then, if things are stable, you might try a very, very slow reduction in the dose, working closely with the vet. But, and this is important, some cats might need long-term or even lifelong management, combining medication with those environmental and behavioral strategies.
Right. It might not just go away completely.
Often not. The main types of drugs used are things like SSRIs, antidepressants, TCAs, another type of antidepressant, or sometimes anticonvulsants like gabapentin.
Are there side effects?
There can be, yes. The text mentions things like maybe decreased appetite, sleepiness, sometimes constipation or urine retention. Often these are temporary, especially when starting the medication, but definitely something owners need to watch for and discuss with their vet.
And are these drugs actually approved for these specific cat issues?
That's a key point the text makes currently. No drugs are specifically FDA approved for treating these particular compulsive disorders in cats.
Ah, so it's off-label use.
Exactly. It's called extra-label use. Vets can prescribe them, but they need to discuss the reasoning, potential risks, and benefits with the owner first. And regular check-ins are vital to see how it's working, monitor the behavior frequency, and adjust the plan as needed.
So it really sounds like a partnership between the owner and the vet.
Absolutely. It's often a process of finding what works best for that individual cat.
Is there anything owners can do to try and prevent these problems from starting?
Yes, definitely. The text really emphasizes creating an enriched environment from the get-go.
What does that look like?
Things like making sure resources, food, water, litter boxes, scratching posts are spread out, not all clumped together, providing plenty of safe, comfy hiding and resting spots, lots of opportunities for play that mimics hunting, and ensuring predictable, positive interactions with people, basically meeting their fundamental feline needs for safety, stimulation, and social contact.
So a happy, stimulated cat is less likely to develop these issues.
That's the idea. A good environment supports good mental health.
Okay, last big question. If a cat does develop one of these conditions, what's the general outlook?
Overall, the text suggests the prognosis for improvement with treatment is generally pretty good for many cats.
That's discouraging.
It is. But managing expectations is important. If a behavior has been going on for a long time, getting instant, complete control is probably unrealistic. Like we said, ongoing management might be needed to keep things stable and ensure the cat has a good quality of life.
So patience and persistence are key.
Very much so.
Okay, so summing up, these unusual cat behaviors, they aren't just quirks. They're often signs of something deeper, maybe stress, anxiety, unmet needs.
Right. Complex issues.
And tackling them really requires ruling out medical stuff first. Then looking closely at the cat's world, their environment, routines, and using behavioral strategies, maybe medication, all guided by your vet.
Exactly. It really prompts you to look closely at your own cat's behavior, even the subtle stuff, and ask, is their environment really meeting all their needs? It fosters a deeper understanding, I think.
Well, thank you, our listener, for taking this deep dive with us into the sometimes baffling, always fascinating world of cat behavior. Definitely gives us all something to think about regarding our own furry companions.